All right. Good morning, everyone, and thank you for coming to our press conference today. My name is Jamie Peddle, and these are my colleagues, Carla Petruquin, Andrew Kabchuk, and Beverly Sharp. I am from Brampton. Carla is from Toronto, Andrew is from Ottawa, and Beverly is from Vancouver. We are all parents of children who have been diagnosed with autism and who are severely affected by the disorder. We are founding members of the Canadian Autism Treatment for Medicare Coalition, and you can find us on our coalition site on Facebook. We are here today to speak on behalf of all kids with autism and their families and caregivers who believe that the time is long overdue for autism treatment to be delivered through healthcare with Medicare coverage. Due to the COVID-19, we have kept this event as a Zoom press conference. During this election campaign, we are once again calling on the Prime Minister and the leaders of the other parties to recognize the lack of access to autism treatment in Canada as a healthcare crisis and to pledge to put into motion the necessary mechanisms and to undertake negotiations with the provincial governments to make ABA autism treatment universally accessible and covered under Medicare across Canada. I am a single father of 4 children. The youngest is a 9-year-old boy with severe autism who needs medically necessary autism treatment. The treatment is intensive behavior intervention therapy based on principles of applied behavior analysis, commonly known as ABA. The medical and scientific communities have long recognized that ABA is the only effective evidence-based treatment for autism. Studies and experience have demonstrated that ABA can have a huge impact on the development of children who are diagnosed with autism. Until the cause and cure of autism are discovered or a more effective treatment is found, ABA is the core healthcare need of children diagnosed with autism. It is long past time that both our federal and provincial governments recognize that autism is a neurological disorder that without treatment can have profound negative effects on the individual, their family, and their community. Many provinces have over the years launched ABA autism treatment programs. Ontario first launched the preschool autism program in 2000. Unfortunately, the program was not treated as a medically necessary health service. It was not assigned to the Ministry of Health, and the program was not given OHIP coverage. Instead, as in so many other provinces, the ABA Autism Treatment Program in Ontario was assigned to the Ministry of Social Services. This is fundamental error in public administration and programming infrastructure. The department that administers welfare does not have the same culture as the department that administers healthcare. Healthcare is based on the needs of the patient, and appropriate autism treatment is much more likely to be effectively delivered by the Ministry of Health than social services. The Ministry of Social Services simply does not have the healthcare expertise or the resources to adequately do the job. Since inception, the Ontario program has been plagued with unconscionable waiting lists and discriminatory age cutoffs. Because ABA is not covered by Medicare, the cost of providing medically necessary treatment has often fallen to the parents who are focused to resort to the private sector. The consequences are that many of our children are not receiving treatment because of their families' inability to pay. This is not only un-Canadian, it is immoral. Over the past 2 decades, the Ontario program has been routinely subjected to tinkering by the government, and today the program is in shambles. The government of Ontario announced changes to the Ontario Autism Program in early 2019, which proposed to give every child a check for approximately 1 month's worth of treatment, which effectively gutted the program and resulted in widespread opposition from the autism community. Since then, the waiting list for access to treatment has grown to over 40,000 kids. The solution is to have ABA universally accessible and covered under Medicare. This means that our federal government must get involved. This is no longer just a provincial issue. The federal government issued a report indicating that the incidence rate is 1 in 66 children. Many of these children need treatment, and the lack of access is a national autism crisis. The federal government owns the Canada Health Act and provides healthcare funding to the provinces through the health transfer, through the Canada Health Transfer. The federal and the provincial governments have routinely negotiated health accords with federal funding specifically tagged for certain healthcare services. Federal leaders have indicated their plans for increasing the Canada Health Transfer and introducing pharmacare, dental care, eye care, and doubling direct investments into palliative care. We need commitments for autism care. The time is long overdue for autism treatment to benefit from the system that has so far ignored the autism community. Over 2,000 Liberal Party delegates at the Party National Convention in Winnipeg in 2016 overwhelmingly voted to pass this resolution calling for Medicare coverage of autism treatment. This resolution clearly lays out the roadmap of how to solve this issue. So what has the federal government done since 2016? Nothing. And that's why we're speaking out. Even Justin Trudeau had said, and I quote him, "How we care for the most vulnerable people in our society is very important." In December 2019, the Prime Minister gave the Health Minister a mandate letter calling on her to work towards the creation of a national autism strategy. Here we are, 2 years later, and there's no national autism strategy to speak of. In 2007, the Senate of Canada issued a report called Pay Now or Pay Later: Autism Families in Crisis. Among other recommendations, this report calls for the federal government to provide treatment funding. It's 2021, and the crisis has only deepened. The federal government must work together with the provinces to move autism treatment to where it properly belongs under the provincial ministries of health, include ABA in each province's list of public insured health services, and provide adequate funding to the provinces to cover the cost of treatment. It is in our collective economic interest to provide early intervention treatment because untreated children will become untreated adults who will require a lifetime of supervision and long-term care at tremendous expense. The more children with autism are able to develop their full potential, the less will be the costs of their long-term care as adults. As Canadian citizens, we have all been conditioned to pay our taxes on the understanding that Medicare will cover our core healthcare needs. ABA autism treatment is my son's core healthcare need. Where is Medicare when he needs it? In closing, I am calling on our Prime Minister and the leaders of the other parties to recognize the lack of access to autism treatment is a healthcare crisis. We need whoever wins this election to act immediately by doing as this resolution instructs. He must put into motion the necessary mechanisms within the federal and provincial governments and to make ABA autism treatment universally accessible and covered under Medicare. This healthcare discrimination against Canadians with autism must end now. We need Medicare for autism now. Thank you. I now invite Carla Patrican to speak.
Good morning, and thank you for attending our press conference. Having a severely disabled, nonverbal autistic son has opened my eyes to Canada's discrimination in healthcare. When my son was just over 2 years of age, his autism became abundantly apparent. Behavioral challenges escalated into full-out self-injurious meltdowns. His sleep came in 2-hour intervals with intermittent screaming for hours. He had no ability to engage, communicate, or self-regulate. With great concern, his pediatrician evaluated no underlying health conditions, informed me my son is autistic and will be put on the list for official evaluation from our children's hospital. He advised me my child required intense behavioral intervention IBI treatment based on the principles of ABA, applied behavioral analysis, to progress and develop to his full potential. However, the pediatrician had no ability to refer my son or prescribe the treatment for him. An official diagnosis would be required from a specialist in order to access any treatment and services. When a child is diagnosed with autism, there is an urgent need for access to autism treatment. Early intervention generates best results for a child's development. My assumption was the Children's Hospital would provide an official diagnosis and access to therapy would follow. That did not turn out to be the case at all. As a parent in distress about my son's condition, I was shocked when his diagnosis led to being put on a regional wait list of the Ministry of Social Services for access to therapy. There are simply no words to describe the blatant discrimination from lack of autism treatment in the healthcare system. We were informed that we could resort to the private sector and pay for treatment. I never thought in Canada a disabled child in urgent need of treatment would be told to consider the private sector. Who in Canada buys health insurance when we have Medicare? Unfortunately, for the many families like mine, the cost of medically necessary therapy in the private sector is simply unaffordable and out of reach. Many children are in full-out crisis. They have 24/7 care needs, serious language disability, and being denied evidence-based therapy to progress. Those who believe that IBI, ABA, autism treatment is too expensive for healthcare coverage need to consider the fact that autism treatment changes the lives and trajectories of the children. Many adults with autism who were never able to access treatment are on unconscionably long wait lists for placement in group homes. In the meantime, media reports regularly highlight the plight of those housed in psychiatric wards of hospitals as their aging parents can no longer handle extreme behavioral challenges. It most certainly did not have to be this way. Evidence-based treatment can improve quality of life. Canada must implement a meaningful national autism strategy of which a core pillar must be enabling diagnosed children with autism to access intervention treatment through healthcare pursuant to national standards and with Medicare coverage. I thank Andrew Kavchak for the years of advocating for the many children like mine. All politicians and interested persons should read the book, The Fight for Autism Treatment in Canada, and understand this merry-go-round of social services files and discrimination in healthcare must end. A true national autism strategy must include Medicare for autism treatment. We need Medicare for autism now. Thank you.
Thank you, Carla. My name is Beverly Sharp, and I'm the very proud parent of a daughter with autism. I'm a founding member of Families for Early Autism Treatment in BC, and I am a board member for the Association for Science and Autism Treatment based out of New Jersey. Our mission is to keep science at the forefront of every conversation regarding autism treatment to help guide parents, family members, educators, and lawmakers make life-saving decisions around autism treatment. When my child was 2 years old, not talking, engaging in odd, repetitive behavior, we knew something was wrong. After waiting to get assessed, the diagnosis of autism was made. Immediately, a social worker was dispatched to my home, where my now ex-husband and I were told, "Your daughter will not be able to stay in the home much longer. We have special homes for children like her." This news was crushing. Well-intended but very uninformed friends and co-workers started advising unsubstantiated therapies. But when I discovered that there was a science-based treatment for autism, I was elated. I was determined to give our little girl the best chance of becoming the best she could be. Intensive behavior intervention based on the principles of applied behavior analysis is, to date, the only bona fide treatment for autism. And by God, I was going to make sure my child accessed it. My shock and disbelief that this treatment, her core need, was not covered by Medicare was profound and confusing. My child is a Canadian citizen. She's entitled to fair and equal treatment as per our Charter of Rights and Freedoms. Yet she was left behind when her core healthcare need for autism treatment was not met. I sprang into action. I hired a treatment team, hired trainers, hired a behavior consultant, paid the flight tickets for the consultant to come to my home to train all green team members. Sadly, at the time, my husband did not want to see his retirement savings spent on this treatment. He left our home 3 months after our little girl's diagnosis. Our daughter was 3 years old. I was now a single parent with a huge task in front of me. I resorted to using my single asset, my home, as my source of revenue to fund my daughter's treatment program. I rented out every single room in my house, and I slept on my living room floor for 16 years. I worked excessive amounts of overtime. I got 2 part-time jobs. I hawked every item of value that I had just to ensure that I could pay for my daughter's treatment program. The treatment was working. My daughter learned to say her first word, mama, after 40 hours of intensive ABA treatment. I could not stop. Today, my daughter's 27 years old, and I'm proud to share that she has learned how to speak. She has paid part-time work. She does a lot of community volunteering at our West Vancouver SPCA, and she's responsible for many household chores. She's part of the household. She's also learned to toilet herself, shower herself, eat appropriately with a knife and fork. Thousands of hours of one-on-one intensive behavior intervention have given my child a skill set which is giving her a life of dignity. She is not an expensive institutionalized adult. In 2004, I was one of the litigants in the landmark Otten case. This case was brought against the government by a small group of parents who had children with autism. The Supreme Court of BC and the Appeals Court of BC had upheld that autism treatment was medically necessary and must be funded by government. Imagine the profuse, gut-wrenching disappointment and confusion when the Supreme Court of Canada overturned these BC court decisions based on the feeble statement, "We, the judiciary, will not order the provinces how to spend their healthcare dollars." In spite of 2 cost analysis submitted by the Auton litigants, which clearly shows every dollar spent on early intervention saves the taxpayer thousands of dollars on adult care. And in spite of a Charter of Rights and Freedoms that clearly states life, liberty, and security of the person is a right. Well, I'll tell you folks, if you're autistic and you're denied treatment because your parents can't afford it, you will not have this right. The Charter also states every individual is equal before and under the law and has the right to equal protection, equal benefit of the law without discrimination, and in particular, without discrimination based on race, national or ethnic origin, color, religion, sex, age, or mental or physical disability. Autism is a mental disability, and there is treatment. When you're autistic, you're not treated equally. You're denied the right to medically necessary treatment, and that is their core health care need. This is discrimination. Folks, it is time to stop the constitutional finger pointing that the governments are using. And what needs to happen? The federal health minister today needs to convene a meeting with all the provincial health ministers, put some money on the table, and negotiate the inclusion of autism treatment under Medicare from coast to coast with national standards. We need Medicare for autism now. It is my pleasure to introduce Mr. Andrew Kavchak. Thank you.
Well, thank you, Beverly, and thank you, Carla, and thank you, Jamie, for your statements. My name is Andrew Kavchak, and I'm the parent of a 20-year-old young man who is severely affected by autism. We're here to ask the federal parties to put an end to the discrimination in Medicare against children with autism and take the steps necessary to ensure that treatment of autism is delivered through Canada's healthcare system and covered from coast to coast with federal funding through the Canada Health Transfer. The provinces are responsible for the delivery of healthcare. We get that. But when it comes to autism, they have dropped the ball. Many provinces like Ontario offer autism treatment through programs that are delivered through the Ministries of Social Services. Regrettably, they don't have the expertise and they don't have the resources. During the last federal election in 2019, the Liberal Party did not make any promises relating to autism. However, in December of 2019, the Prime Minister's mandate letter to the Health Minister requested that the minister work towards the creation of a national autism strategy. He did not request her to develop and implement such a strategy, but merely to work on it. So it should be not at all surprising that here we are 2 years later, and there is still no national autism strategy, nor any indication of when we will see it, nor any indication of what may be in it. Instead, the government has launched another consultations festival. The autism community has been through this consultation process several times, and we are not impressed. In 2007, for example, the Standing Senate Committee on Social Affairs conducted an inquiry into funding for autism treatment. That committee recommended that the government negotiate a funding formula with the provinces. At the time, the Conservative government completely ignored the report and the recommendations. However, in 2015, the same Conservative government budgeted $2 million for consultations to develop some sort of an autism project proposal. When that proposal landed on the desk of the health minister in the current Liberal government, they too completely ignored the report, dismissed it, and never said what they thought was actually wrong with it. Now, the autism community has experienced this kind of consultation dead-end treatment at the provincial level many times over the past years. In 2019, when the Ontario government conducted consultations about its autism program reform fiasco, many parents, including my colleagues here, Jamie and Carla, and myself, made submissions calling for Medicare coverage of autism treatment. In Ontario, that's OHIP, the Ontario Health Insurance Plan. Yet, when the consultative report to the government was released in the fall of 2019, it didn't contain a single word on the subject. Our voices clearly did not count. In 2020, the federal government announced it would spend $1.4 million on consultations to be carried out by the Canadian Academy of Health Sciences for purposes of developing a report and recommendations for a national autism strategy. And what will the government do with that report and those recommendations? So far, the federal health minister has already stated that it will be subject to further consultation. The autism community has had enough of this consultations merry-go-round to nowhere. We want action, and we want it now. Parents like us who lobby our politicians always encounter resistance and excuses. Yet, in this pandemic, the federal government has taken swift action when it perceives there to be a crisis. We would like to see the same kind of decisive decision-making and corresponding action with regard to autism treatment. We are asking for the leaders of the parties to commit to implementing a meaningful national autism strategy that will have as its core pillar the provision of Medicare coverage for autism treatment. We are calling on the federal government to convene a meeting with the provinces, to put some money on the table along with other incentives from their toolkit, and negotiate with the provinces a health accord that would ensure autism treatment is provided through healthcare pursuant to national service standards and with federal health transfer contributions. To those who say that it can't be done, we point to the current existing healthcare system of rehabilitation services delivery, which can be used as a model for the delivery of autism treatment through healthcare with Medicare coverage. Rehabilitation services often are needed to recover from illness, surgery, or injury. And the Ontario Health Insurance Plan covers the cost of inpatient rehabilitation care. And that rehabilitation care that takes place in an outpatient clinic, the home, or the community may also potentially be covered by OHIP. Such rehabilitation healthcare services typically involve one or more members of a team, a rehabilitation team consisting of psychologists, physiotherapists, occupational therapists, speech therapists, social workers, and nutritionists. Why can't we add board-certified behavior analysts who are specialists in autism treatment to the mix? In every election, the autism community hopes and prays for political leaders to confirm that our children with autism matter and that they will do something to improve access to treatment. Regrettably, previous elections have been disappointments, and so far, this one is no different. The Liberals have pledged $4.5 billion over 5 years for mental health. The money is to be transferred to the provinces through a new and permanent mental health transfer. That's something we are happy to support. But what about similar funding for autism treatment? Why is autism treatment always excluded? The Conservative election platform says nothing about autism. However, it does propose to spend an additional $60 billion over 10 years on healthcare, which is supposed to provide enough funding through health transfers for an additional 1 million Canadians to receive mental health treatment every year. Why can't some of that fortune be used to provide autism treatment for kids with autism who need it? Why are kids with autism excluded from this healthcare windfall? O'Toole has stated that autism treatment is strictly a provincial matter and has nothing to do with the federal government. Yet, the Conservative election platform specifically proposes to double direct investment in palliative care. Once again, that's wonderful, and we are fully supportive. And in fact, it would be happy to see it increased even further. But why is it that Canadians on their deathbed are worthy of doubling of direct investment, but children with autism, with their entire lives ahead of them, are not worthy of a single Conservative dime? Similarly, consecutive budgets in Ottawa seem to now have this mandatory provision of huge sums of money to being budgeted to tackle the opioid addiction crisis in this country. In their election platform, the Conservatives described the opioid epidemic as a healthcare issue. But instead of saying it's entirely a provincial problem, they pledged to spend hundreds of millions of dollars to create 1,000 residential drug treatment beds and build 50 recovery community centers across the country. Once again, we support that, and we would be happy to see it increased. But what will it take for the Conservatives to spend anything on autism treatment for kids who have a whole life ahead of them and who are currently on waiting lists and ignored by the provinces? The NDP have provisions in their platform to make major reforms and amendments to the Canada Health Act and Medicare across the country. We've all heard about their desire to implement pharmacare, dental care, eye care. In their platform, under the healthcare reforms, they don't say a word about autism. There's no autism care. However, in the section on disabilities, there's a sentence at the very end where they indicate that they will develop and implement a national autism strategy. We fully support that, and we're grateful that they mention it. However, where are the details? One of the references is to improving access to, quote, needs-based services. What are these services that they are thinking of? Is it treatment under Medicare, or is it respite and summer camps? If it's treatment, why not say so? Why is it so difficult for the NDP and the other parties to say, we want kids with autism to access treatment under Medicare? What all these promises from all the political parties demonstrate is that where there is a political will, there is a way. Where is the will to help kids with autism access treatment? We are only asking to be treated as are all other Canadians under Medicare. We need Medicare for autism now.